mediation. We think it would be great to get mental health professionals to do more of this, but it's difficult sometimes to find people who have the time who want to do it, if that makes any sense. So it's not that, if people are working and seeing a lot of people during the day, they don't really have that much time for the mediation. That's something that came up with the CCMMH, the organization I talked to you about before, with mental health trainings, mental health mediation trainings back in the early 2000s. So we thought peers were the best place to start. And I just wanted to sort of give you an overview of how we were looking at different mental health communities and how we made that decision. Let me quickly tell you what a mental health perspective is. This is from the cultural sensitivity training that I've been alluding to, that I just did in Nebraska and we do in other states. A mental health perspective is a point of view, and the perspectives can be different based on roles in the system, meaning if you're a mental health professional, a family member, or a peer, or person with lived experience. They can be different based on the ideas about the nature of mental health problems. So what's causing these problems? How are we diagnosing these problems? People debate about different ways to do that, and that can shape someone's perspective. The perspectives can be different based on rights. So some people think you should force treatment very early. If you notice that there's a problem with a loved one, we should make it easier to force them to get treatment because we don't want to let them be left to their own devices while they're sick. And some people think we should be very, very strict before we allow someone to take someone's rights away and put them into treatment against their will. So that can shape someone's perspective. And then there's different views about treatment, whether you're going to follow the medical model and get a lot of mainstream medication, or whether you're going to try alternatives, things like mindfulness and supplements and different things. So these are just some categories by which perspectives can be different. And the reason I'm introducing it to you now is